Would you believe that skipping breakfast might save your life? That's exactly what happened to my friend George. George is 75. A retired firefighter. Tough man. But 2 years ago, he collapsed during his morning walk. Doctors said it was a mild heart attack, a warning from his heart. What scared George most wasn't the heart attack. It was that there were no symptoms before it. No pain. No shortness of breath. It just hit him out of nowhere. I visited him in the hospital. He looked at me and said, "Harold, I don't want to die yet. I want to see my grandson graduate." That moment changed everything. 6 months later, George called me, full of life. "You won't believe what helped," he laughed. "I started intermittent fasting. No fancy meds. Just skipped breakfast." His blood pressure dropped. His energy came back. His doctor was shocked. And me? I was curious. So I started digging into it. The science. The real results. And what I discovered changed my own heart, literally. How could something so simple protect your heart health, prevent stroke, improve insulin resistance, and reduce your risk of atherosclerosis? In today's story, I'll walk you through what George did, and what I now do every single day. It is the most important story I've ever told. Stay with me till the end. I'll show you how to start safely, even at 70 or 80. And if you've ever tried fasting before, tell me in the comments below. I'd love to hear your experience. Let's dive in. What if the very thing we fear, hunger, could be the thing that heals our heart? It sounds ironic, right? But it's true. George told me once, I thought skipping meals was dangerous at my age. But the real danger wasn't skipping a meal. It was eating too often, and never giving his body a break. For decades, we've been told to never skip breakfast. But let me ask you this. If eating all the time was so healthy, why are so many seniors struggling with high blood pressure, heart failure, and insulin resistance? The truth is, every bite of food, especially sugars and starches, ends up. And when insulin is always high, your cells stop listening. That's insulin resistance. And that's the silent killer behind so many health problems in seniors. The surprise here is, when George stopped eating breakfast, something unexpected happened. His blood pressure dropped. His energy returned. His doctor even reduced his meds. He wasn't starving himself. He was letting his body finally burn fat, and make ketones. Ketones that protect the heart, fuel the brain, and repair the cardiovascular system. That's what intermittent fasting does. It gives your body time. Time to heal. Time to reset. And when you're in your 70s or 80s, time is the most powerful medicine. In the next part, I'll explain how ketones are not just fuel, but healing agents for a damaged heart. And hey, if you've ever tried skipping breakfast or doing a 16:8 fast, drop a comment below. Was it hard? Did it help? I'd love to hear your journey. This story is just getting started, and you won't want to miss what comes next. The human heart never sleeps. It beats about 100,000 times a day, without asking for a break. But what happens when we keep feeding it the wrong fuel? That was George's problem. And truth be told, mine too. You see, when we eat a high-carb diet, our bodies run on glucose. But glucose is like a dirty fuel. It creates waste, inflammation, and burns fast. Our hearts end up working harder, aging faster. What I didn't expect here was, the heart doesn't even prefer glucose. It prefers fatty acids, and even more so, ketones, especially acetoacetate. These ketones are clean, efficient, and reduce the heart's oxygen demand. In other words, your heart works less, but gets more done. But with insulin resistance, your body can't burn fat properly. It stays stuck on glucose. And the more carbs you eat, the higher your insulin levels stay. That traps your body in a vicious cycle of fatigue, high blood pressure, and heart risk. George used to feel exhausted just walking to the mailbox. After starting intermittent fasting, his body finally accessed its fat stores. His heart got the ketones it needed, and within weeks, his energy was back. I'll explain in the next part how atherosclerosis and stiff arteries also begin with high insulin levels. But right now, I want to ask, have you or your loved ones ever been told to eat frequently to avoid low blood sugar? Let's break that myth. Leave a comment below and tell me what your doctors say about eating habits. And remember, your cardiovascular system isn't failing. It's just waiting for the right fuel. Stay tuned, because we haven't even touched the most surprising part yet. What if your damaged heart wasn't broken, just hungry for the right fuel? That's what George's cardiologist realized after months of confusion. Despite all the medication, strict diets, and low-salt meals, George's heart function barely improved. He still had atrial fibrillation, occasional chest tightness, and poor stamina. His doctor was ready to recommend surgery. But then, something changed. George started intermittent fasting seriously, 16:8 every day, some days even 20:4. His body entered deep ketosis. And slowly, his heart stabilized. The rhythm returned to normal. His doctor was stunned. Why? Because ketones, like acetoacetate, don't just power the heart. They heal it. Research shows that damaged heart cells, especially after heart attacks, can't efficiently use glucose. But they can still absorb ketones, and prefer them. Ketones bypass the usual insulin-glucose pathway and directly energize heart mitochondria. That means more power, with less strain. It's like switching from coal to clean solar energy. George wasn't the only one. Thousands of seniors around the world have reported reduced blood pressure, more energy, and better heart rhythm, just by switching fuel. In the next part, I'll explain why atherosclerosis, stiff arteries, might reverse if you reduce insulin and switch to fat-burning metabolism. But now, tell me this, have you or someone you know been diagnosed with heart failure or arrhythmia? Have you tried fasting or a keto diet? Drop a comment below. Your story might help someone else heal, too. Remember, your heart is strong. Sometimes, it just needs a little help remembering how to beat freely again. What if the stiffness in your arteries wasn't permanent, just a warning sign? That's what I discovered, far too late, after my first heart scare. Back then, I thought high blood pressure was normal for someone my age. The doctor said, take the pills and relax. But nobody told me why my blood pressure was climbing. Nobody told me about glucose damage. Every time we eat sugar or refined carbs, insulin spikes. And that excess glucose starts damaging the inner lining of our blood vessels. It's called the endothelium, a fragile, microscopic barrier. When that lining is injured, the body rushes in to repair it, with cholesterol and calcium. Sounds helpful, right? But that patchwork creates plaques, stiffens arteries, and boom, you've got atherosclerosis. Here's where intermittent fasting changed everything for me. When I began fasting, I wasn't just skipping meals. I was stopping that glucose assault. Insulin dropped. My blood vessels got a break. The inflammation calmed. And most importantly, my blood pressure came down, without extra medication. George saw the same results. No more morning dizziness. No more afternoon pounding. Just calm, stable, steady. The secret? Ketones. They're not just a better fuel, they protect the endothelial lining. They reduce oxidative stress, making the vessels more elastic, less stiff. And as elasticity returns, blood pressure drops naturally. In the next part, we'll talk about how to transition into fasting safely, especially if you're already on blood pressure meds. But right now, I want to hear from you. Have you ever had a blood pressure spike that scared you? Did your doctor mention atherosclerosis? Let's talk in the comments, your story matters. This journey isn't about fear. It's about understanding, and choosing the path to a stronger, freer heart. The scariest sound is silence. Especially when your heart skips a beat. George called me once at 3 a.m., breathless. I felt like my heart just stopped, then jumped. It's racing now. I knew exactly what it was, atrial fibrillation, or as doctors call it, AFib. Irregular, fluttering, and sometimes terrifying. What causes it? One big reason, electrolyte imbalance. Your heart relies on minerals like magnesium, potassium, and sodium to keep its rhythm. But when you have insulin resistance, your cells can't absorb these electrolytes efficiently. Even if you eat well or take supplements, it might not be enough. I discovered the secret. Intermittent fasting doesn't just lower insulin. It improves electrolyte absorption. That's why, after a few weeks of fasting, George's palpitations stopped. His rhythm became steady. He said, "It's the first time in years I don't feel like a ticking bomb." Ketones also help. They reduce inflammation and oxidative stress, which can trigger irregular rhythms. Your cardiovascular system becomes calmer, more resilient. George even started walking in the morning again. No more fear. Just freedom. In the next segment, I'll show you how to combine fasting with hydration and mineral support, especially for seniors. And now, have you ever felt that sudden heart flutter? That "oh" moment? Leave a comment, you're not alone. And your experience might save someone else. This isn't just about a heartbeat. It's about taking control of your rhythm, and your life. What if you could turn back time, not with medicine, but with mindset? George didn't believe it, not at first. When he started intermittent fasting, he was hesitant. He said, "I'm 76. Is this too late for me?" His blood pressure was high. He had chest tightness almost every evening. He felt weak, slow, like his best years were behind him. But he gave it a try. 16:8 fasting. Simple changes, no breakfast, early dinner, clean hydration. He didn't do it for weight loss. He did it for his heart. And by day 30, something shifted. The pain vanished. His energy surged. And most of all, he felt in control. His doctor reduced his meds. His blood pressure normalized. And at his next appointment, he said a line I'll never forget. "Harold, I feel like I'm 60 again." And the sparkle in his eyes said it all. That's what ketones, lower insulin, and better electrolyte balance can do. They don't just change numbers. They restore confidence. They restore identity. George became more than a patient. He became an example. He started walking every morning. Sharing his journey with friends. Even recorded his blood pressure in a little red notebook. In our next and final segment, I'll share the simple checklist that George used. So you or your loved ones can start this journey too. If you're inspired by George, drop a red heart in the comments. Or tag someone who needs hope. Because this story might become your story next. You don't need to be perfect. You just need to begin. That's what I told George on day 1. He asked, "Do I need to stop eating completely?" I said, "No, my friend. Just delay your breakfast." That's how it starts, a gentle shift. Instead of breakfast at 7 a.m., try 9 a.m. Then slowly move to 11 a.m. Pair it with an early dinner around 6 p.m. Now you're doing 16:8 intermittent fasting, without any pain. Drink only water, herbal tea, or black coffee during fasting hours. No juice. No snacks. No sugar. Your body will switch to fat burning, your insulin will drop. And soon, your cardiovascular system will thank you. But listen carefully if you're taking heart medication or insulin for diabetes. Please talk to your doctor first. Fasting changes how your body reacts to meds. Your dosage may need adjusting. Who should try this? Seniors with high blood pressure, atrial fibrillation, or prediabetes. Anyone wanting better energy, focus, and longevity. But if you're underweight, pregnant, or have eating disorders, this isn't for you. I've pinned a 30-day checklist in the comments. Start small. Track your progress. And remember, even one step is a step toward a stronger heart. Share this video with someone you care about. Let's create a ripple effect of healing, one senior at a time. Fasting isn't about punishment. It's about permission. Permission to heal. To breathe. To live on your terms. I used to think fasting was about weight loss. But now, I see it differently. It's about choosing awareness. Slowing down. Letting the body rest, so the heart can speak again. I don't fast because I want to be young. I fast because I want to stay present. For my grandkids. For my community. For myself. Because a calm heart beats longer. A steady rhythm brings clarity. And a mind not ruled by sugar or pills finally finds peace. If you followed this far, I hope you hear what I'm saying. Fasting is not just for your blood pressure or your electrolytes. It's for your soul. If this video helped you, like it, share it, and pass it on to someone you love. And tell me, what's your reason for living to 90, strong, clear, and free? Let's age wisely. Not just longer, but better.